Authority in tatters. Is this the moment for some of you that perhaps for Boris Johnson it really is the end of the line, the end of the road? David in Enfield. David, you're on the radio. Good morning.
Good morning, Nick. 4 very quick points. Firstly, the PM is a public servant. As such, he's expected to abide by the Nolan 7 principles of public life, and the 3 most important are honesty, integrity, transparency. Secondly, as the Prime Minister, he's expected to lead on the ministerial code, which includes honesty and integrity. Thirdly, he's obviously lied to Parliament with his statements on these parties. And the last point is the complicity of other attendees and the police. Rishi Sunak was at number 11, so he must have known what was going on, unless he attended.
Well, we don't know.
I just think he's lost all credibility.
All right, we don't know, of course. Let's not suggest that Mr. Sunak knew of anything improper going on, just because, of course, I know his offices are very close, but not necessarily, although it does appear that 100 people were emailed with details of that party. David, thank you. I'll end there because I can actually turn to a health minister. Now, while there are testing times for the government, there have actually been changes that we must get across to you as to how you test if you think you have COVID and whether or not you need a PCR. Changes then explained now by Conservative MP and Health Minister Ed Argar. Good to have you on, Minister. What are the changes that come in as of... Good morning, sir. What are the changes that come in as of today?
So for the key change is if you are asymptomatic and you take a lateral flow test and it's positive, you don't need to take a confirmatory PCR anymore. That's the key one. There are a number of other changes as well, and some people will still need to take a PCR. So if you're symptomatic, you will still take a PCR. If you're, for example, one of the clinically extremely vulnerable and advised by your clinician to do so, you will do that. Or if you're on a scientific research trial as well. So we'll still have that genomic sequencing capability there with the PCRs to be able to understand if any new variants have emerged. But given the prevalence of the disease in our society at the moment and in the community, the lateral flow tests are effective and are accurate enough, and therefore we're saying you don't need to do, if you have a positive lateral flow test, you don't need to take the PCR as the follow-on to confirm it.
Noting the extraordinary level of demand for the lateral flow tests, and nearly 1.75 billion have been distributed. There were reports at the end of last week of problems of distribution or supply shortages. Where are we now on that, Minister?
Well, this is where I may get my figures slightly wrong, but I think I'll be broadly right. I think we got up to 12 million in the latest figures I got from my officials. The highest before we distributed was 8 million. So yes, over the Christmas period, there were some delays, some bumps. I suspect that's probably a factor of both supply and in terms of distribution, but also of demand over the Christmas period when everyone wanted to see family and friends and were probably taking more regular tests. We've got the supply. We're getting it out through the community portal primarily. So if you go online to order one to be sent to your house, you should be able to do that. And as I've said on your show, I think before, if you can't get one, just refresh and try again a bit later, because we're constantly adding more to that portal. So we've got the supply, we've got the distribution. That's a key defence line, along with the therapeutics and along with the vaccine, in allowing us to get our society back to normal.
On other matters, how close are we to having isolation cut down to 5 days?
Well, you'll have seen that Greece and the United States have opted to do that. We haven't. It'll be a decision that will be based upon scientific advice, because essentially we moved it down from 10 days.
Some of it seems to be misleading, though, doesn't it?
Well, I think what you saw there, the correction I think you're probably referring to, and as ever, Nick, I always say this, I read my morning papers before coming on your show this morning. I think you're referring to AXA changing it, having to update and change what it put on its blog.
That's the UK Health Security Agency acknowledging it was wrong to claim.
It was inaccurate in what it said about America and how it calculated it, but I don't think the fundamental science was inaccurate, which is that the science is the same and different countries have taken a different view of essentially what is the scientific risk. If you reduce it from 7 to 5 days, yes, you could potentially have a positive impact on number of people not having to self-isolate, but if people are still infectious for those 2 days, are you creating a risk of greater transmission and someone still being infectious going into a workplace and creating an outbreak? That's the balance we need to strike. We'll take scientific advice, and that's a scientific question. At the moment, the scientific advice is to stick where we are at 7 days. But if that changes, we review it all the time. If that changes and they say it would be safe to move to 5 days, then of course we would look at that.
When might that decision be made? Because there seems to be a growing band of senior Conservatives, such as the Prime Minister, your boss Sajid Javid, Rishi Sunak, Nadim Zahawi, and others, saying that we should move towards 5 days.
Well, I think we would all wish to, if the scientific evidence made clear that that was the safest way to do it and that it didn't increase the risk of someone still being infectious and potentially causing a workplace outbreak. So we get updates very regularly on the latest science. Should that move in a direction which would allow it? I know that you will have heard the Prime Minister yesterday. He's asked the scientists to continue looking at this. And if that can be done safely, of course, it's something we'd like to do. But we've got to be led by the science on that one.
OK. Noting that you're the health minister, some would argue you've been dealt the hospital pass this morning because it falls to you to defend what we understand was this event, this party or whatever, on the May of 2020. Were you in attendance? Were you invited?
Well, firstly, it's never a hospital pass to appear on your show, Nick. It's always a pleasure to talk to your listeners.
Thank you.
No, I haven't attended any parties at Downing Street or during the course of 2020. I can't think of anywhere else. I spent most of my time, I think, in 2020 glued to my Zoom or my Teams or being interviewed by you and others there or in meetings with my officials about ventilator supply or building Nightingales or similar.
Why should my listeners believe or listen to a word the Prime Minister says when it appears he's so bent he can't lay straight in bed?
Well, Nick, you have the facility with the memorable phrase, but I don't think that's a particularly
He's lied
fair
and lied
reflection.
And lied again.
What we have seen here, Nick, is a number of allegations. And first of all, I can say I can entirely understand on the basis of the allegations and the reporting by the media of what's been alleged, why people would be understandably angry and upset and hurt because we've lost over 150,230 of our fellow citizens to this virus. We've seen people endure huge restrictions to their lives, unable to attend family events, and with significant mental health challenges and, of course, challenges around business, family, finances. So I can understand why these allegations are extremely upsetting and angering to people. And that's why I think it's right.
I have to say, Minister.
And that's why I think it's right, Nick, that he's the Prime Minister, both in terms of before Christmas, came to the House and said he apologised and he was sickened. He could understand why people were sickened about the videos and about the allegations of parties and why he's done the right thing, which is commissioning Sue Gray, who is a very senior and experienced civil servant of the greatest integrity, to look into the facts behind this and report without fear or favour. I've come across Sue Gray before. She will look into this without fear or favour. She has the highest standards of integrity, and I know that I'm keen, as I suspect your listeners are, to get those facts.
Indeed we are, but you referenced the Prime Minister appearing in the House of Commons. He said there had been no parties, but we now know that an email was circulated to around 100 people talking of a party which possibly the Prime Minister and his then fiancée attended. He's misled you, he's misled me, he's misled the public, he's misled the House, hasn't he?
Well, Nick, you quite rightly and quite fairly there said possibly, and that's the key word here. There are a number of allegations. I've seen the email last night. I've also seen, I think this morning, the Met saying they're in contact or in conversation with the Cabinet Office. And of course, we've got Sue Gray looking into this and looking into not just this, but a range of other allegations. I think it's right that she's given the space to do her job, to look into that. And I hope she will be able to do it swiftly and make her findings public. So these are allegations at the moment. I do not know. I didn't attend any parties, so I don't know from personal experience what did or didn't happen. And therefore, I think it's right she's given the space to investigate that and to determine what did happen or not. And
the work Sue Gray will do will encompass this latest party or alleged gathering, will it?
Well, my understanding is it's up to Ms. Gray. You know, she has the freedom to set her scope to investigate allegations. I think her scope is allegations of breaking of regulations and rules in this context. So my understanding is she would have the scope to be able to do this. That's up to her. It wouldn't be right for me to come on and suggest what she should or shouldn't do. That's, I think, a key element to people having confidence that she is doing this without fear or favour, that I'm not going to comment on the work she's doing, that she has the right to go and investigate what she feels is appropriate.
And lastly, there seems to be a suggestion we need to get the economy going, that we possibly by this spring, if we can see a glimmer of light at the end of the tunnel, we look to moving to whatever the new dynamic will be, people doing 4 days in an office and 1 day from home, whatever it might be. For the sake of the economy, how important is it, Ed Argar, that we do move to that as soon as we can?
Well, I'm very clear that before Christmas we took the Plan B measures, which were proportionate and measured to help us tackle the Omicron variant. We have seen in recent days those cases, particularly in London, starting to plateau and come down, and hospitalisations starting to slow. I'm always cautious about predicting until I've seen it sustained for a period, but it's absolutely vital that as soon as it's safe to do so, as soon as we're able to do so, we ease those restrictions, for example, working from home or otherwise, and try and get our society back to normal as we learn to live with this virus.
Grateful for your time today. Thanks, Health Minister Ed Argar, appearing here on LBC, or at 8 o'clock. The news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Liberal Democrat leader